When I was 21, I was forced to medically retire from college athletics due to a hip injury. I want to point out a couple things. One, my injury and tear in my labrum had been confirmed by MRI imaging, athletic trainers, physical therapists, and my orthopedic surgeon who had seen the tear firsthand during my previous hip surgery. And two, it had been agreed upon between me and my surgeon that when I was no longer physically able to play basketball, I would have the reparative surgery that I needed. When I was ready for the surgery, I approached my surgeon, and he requested that he get updated imaging of my injury, which is completely routine. What wasn't routine, that was in addition to my images of my hip joint, he also requested imaging of my pelvic area without letting me know. It was then the day before my surgery, and I received an automated text from my hospital saying that my surgery had been canceled. My surgeon informed me he had canceled it because he saw that I had been on my period and that back pain is a normal symptom of that. He told me not to be embarrassed because it's easy to confuse back pain with hip pain and I should try taking some Advil. There I was, unable to walk with only 3 millimeters of labrum still attached to my hip socket, unable to receive care because my symptoms were swept under the rug of menstrual issues. Sadly, my story is nowhere near unique. People who menstruate have been victims of medical bias for centuries. Hysteria was a valid medical diagnosis up until the 1980s that doctors would use to describe symptoms in women from chronic pain, seizures, autoimmune dysfunction, psychological distress, and more. This diagnosis came from a medical theory known as wandering womb, which was written to believe that all negative or harmful medical symptoms in women were caused by the uterus wandering throughout the body, causing issues. This was and even still is a way for the sexual and overall health of women and people with uteruses to be silenced and kept sick. Sexual health is extremely personal. I know it may feel awkward or icky to talk about, but I encourage you to push through that discomfort. Educating yourself about your body is the first way and the first step to advocate for the best care for yourself and your community. We are part of the very first few generations with access to credible medical and sociological information about sexual health. Do not take it for granted while we still have it. Historically, and especially now, being healthy is revolutionary. So be revolutionary. Thank you.